Welcome to Nipple Selection 101, where you learn about health benefits of selecting a great infant nipple for feeding. What is nipple selection? Nipple selection is when the parents of the infant is educated on different types of bottle nipples that may be beneficial for the infant. The parents may learn of the different type of nipples from their infant's pediatrician, lactician, or conduct their own research on the nipple that they feel best for their infant. This may also include talking to other parents who may have children your infant's age or who has experience with selecting the proper nipple for their child. Nipple types. So many people may not know that there are many different nipple types that you can choose from when choosing nipples for your baby for feeding. First, we have the traditional nipple. These are the most basic version of nipples and are quite cost effective. These are bell-shaped with the nipple tip and base quite narrow. They fit well with the standard types of bottles. The flow of milk is quite slow with these nipples, making them ideal choice for feeding very small babies. So these are the nipples that you will typically get when you're in the hospital before you have the option of picking your own type of nipple. And as you can see, as it mentioned, that they have a slow flow because a slow flow nipple is best and preferred with very small babies, such as premature babies. Next, you have the naturally shaped. These nipples mimic a mother's nipple and therefore are useful when you are trying to shift your baby from breastfeeding to bottle feeding. Next, we have the anti-vacuum or vented nipples. Some babies gulp a lot of air along with milk due to poor sucking mechanism. This can cause problems like clotted gas and constant irritability in babies right after feeding. Anti-vacuum or vented nipples are designed to prevent these digestive problems in babies. So this type of nipple is where you have some parents, they may complain that their baby has gas they can't get out. They're very cranky because they can't get that gas out. So that's something to really keep in mind when you're selecting nipples. Ask your pediatrician or doctor if these nipples are anti-vacuum or vented nipples. Then you have the orthodontic nipples. If the right kind of nipple is not used for bottle feeding babies in their initial months, it can cause a lasting damage to their teeth and gums. Orthodontic nipples promote healthy teeth formation. The orthodontic nipples are designed to prevent your baby's tender gums and teeth from getting damaged. So, it's also important that you pick a type of nipple if you're going to be the parent that keep your infant on bottles to a extended period of time. You have to keep in mind that will this nipple damage the formation of my baby's teeth as they begin to develop, which can also contribute to speech articulation disorders. The importance of selecting the right nipple. To avoid milk restriction, nipples that restrict milk flow can obscure the infant's intended beneficial respiratory effects. So this comes into play with when infants, of course, when they're eating, they're of course breathing at the same time. As for adults, we can't eat and breathe at the same time. We have a moment of where our air valve closes when we are eating versus when infants, they are able to swallow and they're able to breathe at the same time. Another important fact to remember is maintain fluid management. So this can be from increased milk flow and swallowing can interfere with the infant's respiratory system. And that kind of ties into what I mentioned previously. Also, proper dental development. Frequent and intense use of certain nipples can cause malformations of teeth, which is what I said about the orthodontic nipple. So those are the nipples to type that you should use if you're thinking that you might be the parent that extends the time of your child being on the bottle. Through my research I've conducted, this is a highly recommended nipple. This is the Dr. Brown's, and as you can see, they have different levels that you kind of move up as your child progresses in age. You can also progress with the nipple levels. So they have the premature, the level 1, the level 2, level 4, and then they have the wide cut, so which is that point of time when you're probably weaning your baby off the nipple and onto sippy cup stages. This is the orthodontic nipple, which will help in the infant's dental development. As you can see, it has an angled top, which reinforces correct tongue positioning, an hourglass shape, which allows the lips to close properly, a feeding hole against the palate, which allows the milk feed to mix with the saliva and aid in digestion. Then it also has the vent to help reduce colic and prevent nipple collapse. It also has an asymmetrical shape, which encourages proper jaw positioning. For more information on the best nipple selection for your infant, please visit www.care.com, where they will have a special link where you'll be able to find and look through different nipple options for your infant. I will add the link in the comment section on below. Thank you.